Welcome to Leaky Gut Solution. The gut or gastrointestinal system is truly a gateway to overall health or chronic illness. This is my favorite topic because if you can heal the gut, you can heal the most chronic health conditions. The gut microbiome is an ecosystem of organisms, including bacteria, yeast, fungus, viruses, and protozoan, throughout the digestive tract. Far beyond just digestive health, the following organ systems are also closely related to the gut: the immune system, endocrine system, nervous system, circulatory system, integumentary system, respiratory system, and reproductive system. A few key points to consider. There's 10 times the amount of bacteria in our body than our own cells, and the majority of them are found within our digestive system. The gastrointestinal system produces 90% of the body's happy hormone, serotonin. Most importantly, approximately 70% of our immune system is housed in our gut. As you can tell, gut health doesn't just stop at digestion. The health of our gut affects nearly every system in our body. Now, leaky gut is a term that refers to intestinal hyperpermeability and has become an increasingly more common health problem seen today. Leaky gut causes major health problems, including autoimmunity. How, though? Intestinal permeability is exactly what it sounds like. The digestive tract is no longer able to ensure the good guys stay in and the bad guys stay out. Instead, the tight junctions or proteins holding the intestinal wall together are loosened. This leaves sizable gaps for undigested food particles, digestive fluids, and toxins to enter the bloodstream. The body reacts to these foreign particles in the blood by producing immune antibodies, or pro-inflammatory cells, to fight them off. This breeds chronic inflammation, food allergies, and various health complications, eventually leading to autoimmune disease, affecting various body parts. Of course, there are no signs of improvement until the gut's permeability is addressed. Fortunately, we now have a better understanding of the causes, obstacles, and treatment methods for leaky gut, so there is a stop to the cycle. Several factors negatively affect the gut's integrity. These are known as triggers of leaky gut. The most prominent include the standard American diet, exposure to chemicals, chronic infections, gluten and other grains, food allergies, excessive medications, poorly managed stress. Gluten can cause inflammation in your gut, thus cause leaky gut. Simple as that. Zonulin, a protein found in gluten, increases the permeability of the gut by further opening the spaces between the cells. The antibodies normally released as a result from leaky gut are accompanied by more antibodies created to attack one of the gluten's more prominent building blocks, gliadin. This leads to more inflammation, more body confusion, and more health complications. In other words, your body reacts to the consumption of gluten by creating a defense mechanisms to fight it. Once this damage has occurred within the digestive tract, it is then distributed throughout the entire body. Aside from contributing, if not entirely causing leaky gut, gluten increases inflammation, overall digestive distress, and alters the balance of our microbiome. Gluten produces both primary and secondary health effects. The damage gluten causes, which I just explained, are causing the primary effects: intestinal hyperpermeability or leaky gut, permeability of the blood-brain barrier, the onset of autoimmune diseases such as celiac disease, Crohn's, and ulcerative colitis, the development of psychological disorders, dysbiosis or abnormal bacterial growth, acute allergenic or IgE immediate responses, and delayed antibody responses, IgG and IgA. While all of these issues are very serious within themselves, they too cause further complications. Next comes the secondary effects of gluten. The secondary effects of gluten exposure include severe nutrient deficiencies, such as iron and B12, systemic inflammation leading to organ and tissue breakdown. It may seem a bit redundant that I keep coming back to how your body acts on gluten, but it's one of the most important pieces of information you can take from this class. Gluten is a major component in the leaky gut cycle. It is present in the onset, the maintenance, and the progression of this damaging condition, and it should not be taken lightly. As you can probably guess, gluten's path to disease is pretty direct. The first step is when gluten's contributing goes unnoticed. At this point, it's likely that there are little to no known symptoms. This is where most people will assume that gluten won't hurt them, and therefore can eat it with no problem. Unfortunately, the lack of apparent symptoms does not mean that gluten does not hurt your gut. In fact, it takes exposure over time and the accumulation of damage before leaky gut will be noticed. For those cutting out gluten before they feel any physical discomfort, they're still treating an underlying issue even if they can't quite feel it yet. The next step is the progression to subclinical problems. This is where leaky gut truly begins to develop. Often the first things will be noticed is increased food and environmental allergies. Digestive distress may begin to be more frequent. Unfortunately, it's common for people to still avoid blaming gluten for their discomfort at this point. The last step is recognizing the problem. However, it's not usually recognizing gluten as the problem, but the acknowledgement of the problem that gluten has caused. For example, if someone is diagnosed with a chronic disease or develops inflammatory changes, most medical doctors will begin treating these conditions rather than examining the origin or the root of the problem. It's a shame that this path to disease happens, because if gluten was recognized as the main problem during the early stages, then a lot of these health issues would be avoided entirely. Gluten, however, is not the only concern when it comes to solving leaky gut. We'll be going over other issues that contribute to this dangerous syndrome in a moment. Much like the additives and preservatives flooding our food supply, pesticides are also a big part of what's on our plates. There are 3 million tons of pesticides used worldwide each year, and more than 16,000 chemicals involved in the production of these pesticides. Studies to ensure their safety on humans have been very limited, whereas some have no documentation research at all. While we're not entirely sure of their safety on human health, we do recognize strong links between pesticide exposure and nervous system disorders, immune system suppression, reproductive damage, hormonal imbalances, thyroid issues, type 2 diabetes, obesity, asthma, migraine headaches, attention deficit disorders, and developmental delay in children. The magnitude that pesticides, along with steroids, hormones, antibiotics, and excitotoxins, show up in our food supply is truly frightening, and these add to the triggering effects of leaky gut. Medication is also a triggering factor. What isn't taken into account is how these excessive prescriptions have affected our bodies and our health. For example, statins, drugs used to lower cholesterol, have shown to lower vitamin D and CoQ10 levels. While it may be lowering cholesterol, it's simultaneously causing nutrient deficiencies, muscle fatigue, increased blood pressure, and weakened immunity. Painkillers like ibuprofen, naproxen, and aspirin contribute to vitamin C and iron deficiencies, leaving one vulnerable to disease and eroding the mucosal layer of the stomach lining. Acid reduction medications hinder the digestion of protein, calcium, and vitamin B12, often causing chronic pain problems. Long-term use of antidepressants significantly reduce the gut's motility and cause digestive issues. The first step of healing is ruling out the fundamental cause of leaky gut. We always want to get to the root. It's important to recognize that it's very rarely only one cause, but a combination of several causing the damage. Once you have a better understanding of your body's unique needs, you can begin the formal functional medicine protocol, the 4 R's. The 4R program is administered to help you heal from digestive distress, reverse gut complications, and rebalance your gastrointestinal microbiome. It is an incredible tool to acknowledge and treat health issues, dysfunctions, imbalances, and personal health needs. The 4R program should be done in the following order. Remove. First, you want to eliminate problem foods, toxins, low-grade infections, and oxidative stress. Then you want to repair. You want to begin reintroducing a clean diet with essential nutrients your body needs to repair. Restore. You want to repopulate your gut with healthy bacteria to restore the proper balance of gut flora. And lastly, you want to replace digestive enzymes, antioxidants, and immune-boosting vitamins to promote a sustainable and healthy digestion. We, as functional medicine practitioners, are trained in this protocol, enthusiastic about making sure your individualized needs are addressed during this process. At this point, you may already have removed things you already knew were to be detrimental to your health, such as gluten, known allergies, but you'll also want to remove much of the chemical burden in your daily life. So this includes pesticides on food, genetically modified foods, unnecessary medications, and chemical household cleaners. This is done by calming the chronic inflammation and reintroduction of nutritious foods, digestive enzymes, probiotics, essential fiber, vitamins, minerals, and amino acids to help with repair. For some people, these steps may mean implementing intermittent fasting to help calm down the inflammation first, then supplementation, or personalized diet plans that cater to their specific needs. Someone might be carbohydrate intolerant or FODMAP intolerant, so these things need to be taken into account. That's where we talk about therapeutic diets. Again, be sure to consult with your functional medicine practitioner to be sure you're beginning the most appropriate repair route for your needs. Nutrients must be replaced for effective healing. While everyone's needs are highly individualized, here are some of the most common supplements that have been proven to be helpful in the gut healing process. Probiotics, prebiotics, which is usually fiber and inulin, digestive enzymes, fiber, collagen, turmeric, L-glutamine, quercetin, and resveratrol. These are only suggestions. We are unable to prescribe these supplements to you without comprehensive testing, as everyone's nutritional needs vary. However, a main takeaway from this is that you should not rely solely on supplements. They can be used to help your healing process, but the goal is to be able to sustain wellness with whole foods and healthy lifestyle choices long term, without the need for piles of pills. The most difficult part of healing is maintaining it. Even if you build a strong foundation during the healing process, without the proper diet, lifestyle choices, and stress management, long term, you can fall right back into the same gut-destroying patterns. Remember, health is a journey, not a destination. For more information, please visit my website, https://functionalnutritionistacademy.com. Here you can learn how to become a certified functional nutritionist, online in your own time.